Okay, so moving to the next discussion, and our next discussion here is the what do they call it? Anti-neutrophil cytoplasmic antibody. So the abbreviation is as follows. Sorry, the abbreviation is what ANCA testing. Okay, ANCA testing. Sorry, ANCA only. Because they measure the amount to see if there's some abnormalities in the body. That's the testing. So anti-neutrophil cytoplasmic antibody is as follows. See it. Okay, so usually see it in all those inflammatory conditions of blood vessels. The levels will be high. Okay, so they're actually autoantibodies. When you say autoantibodies, it's like a disease condition that the body's own immune system is attacking the body's own tissues. You know, so their presence strongly shows that there is all these autoimmune disease conditions that what the blood vessels are getting inflamed, like mostly all those granulomatosis with polyangiitis, microscopic what polyangiitis, eosinophilic granulomatosis. So they're actually also antibodies that are directed against components of neutrophil cytoplasm. So target proteins. This type, the cytoplasmic one, the cytoplasmic one usually targets the proteinase 3. The perinuclear one usually targets the myeloperoxidase. Okay. So they are related to all those, blood vessel inflammation. Okay. So what are the different conditions that I can see it's been high? Okay. All those granulomatosis with polyangiitis. It was formerly called the Wegener's disease. Okay. All those inflammation in blood vessels, in kidneys, in the lungs. Okay. Inflammation of nerves, inflammation of skin, joints. You can also see the level being high. It's also associated with asthma, eosinophilia, and also inflammatory bowel disease, IBD. Okay. So usually test it if you are suspecting that there's an inflammation in the blood vessels. Also to monitor the disease activity. Maybe as you are treating the person, you are testing to see if the person is getting better or not. So interpretation, you can see a positive result suggests that there's autoimmune inflammation of the blood vessels. You can see a negative result. This one makes it that the blood vessel inflammation is less likely. Okay, so I think this is what we have. So we use it early on to dictate if there's all those blood vessel inflammation diseases.